This is the third video on hepatitis C and will discuss treatment. The general principles of management are given here. Firstly is to avoid alcohol. Then vaccination against hepatitis A and B is recommended. A minimum of 2 cups of coffee a day might help protect the liver by slowing down progression of scarring or fibrosis. Let's now look at the more specific management of chronic hepatitis C. The goal of treatment is to clear or eradicate the virus, and in doing so, it will decrease complications like liver cirrhosis, liver failure, liver cancer, and early death. Before starting treatment, the doctor will assess the following: viral load or the amount of virus in the blood, genotype of the hepatitis C virus, fibrosis or scarring of the liver, any previous treatment for hepatitis C, and kidney or renal function. There are several new medications, and these medications are highly effective, well tolerated, given orally, that is through the mouth, and most importantly are safe. These drugs are called DAA, which is direct acting antiviral drugs. These tablets are usually given for 12 weeks, although in some patients, shorter treatment of 8 weeks is possible. Your doctor will check the blood test for the HCV RNA at 4 weeks after starting treatment and 12 weeks after completing treatment. %95 of chronic hepatitis C will be cured, and no virus, that is the HCV RNA, is detected at 12 weeks after completing treatment. This is called a sustained virologic response, or SVR, and data suggests that the patient will stay virus-free indefinitely. After treatment, the virus does not come back. It is important to know that after treatment, the patient can still get infected if exposed again to the virus, as immunity does not develop to the virus. Once the patient is cured, no specific follow-up is required unless the patient has cirrhosis of liver or significant liver fibrosis. The commonest side effect of treatment is nausea and trouble sleeping. Other more serious side effects are rare, and these include skin irritation, poor appetite, hair loss, anxiety, depression, and aggressive behavior. As I mentioned, after treatment is completed, all patients with liver cirrhosis or significant liver fibrosis should be followed up indefinitely by the doctor. This is because such patients have a lifelong risk of developing liver cancer. There is no vaccine available for hepatitis C. Let's now look at some of the treatment regimes. This is a table that shows the different types of direct acting antiviral or DAA drugs that are used in chronic hepatitis C. The choice of the medicine will depend primarily on the genotype. These drugs are always used in combination as they are more effective and also to prevent resistance to the medications. The drug combination is written here, and it depends on the type of genotype. These are genotype 1 and 4 and genotype 2 and 3, and the treatment duration in weeks. For example, this combination of ladipasvir and sofosbuvir is effective for genotype 1 and 4, but not for genotype 2 and 3, and the duration of treatment is anywhere between 8 to 12 weeks depending on the patient. Another combination of glecaprevir and pibrentasvir is effective for all the genotypes 1 and 4 and 2 and 3, and treatment duration is also shorter at 8 weeks. The treatment duration is usually longer if the patient has got cirrhosis.